Slim Chickens is the proud kitchen sponsor for New Mexico Living.
Support for every step of your journey. Addiction comes in many different forms and can affect an array of people, from the individual themselves, their families, friends, coworkers, and more. But there is hope, and that hope is that recovery is not a journey that you have to take alone. So we are joined by Bernalillo County Deputy Manager Lisa Cedillo-White and Community Program Manager Erica Abeyta, highlighting Keep NM Alive, breaking down how this initiative, this program is broadening its scope. Ladies, welcome. Thank you for being here today.
Thank you for having us.
This is a super important conversation, so I just want to get right into it. Can you tell our viewers what Keep NM Alive is?
Sure. Keep NM Alive is a campaign that started in 2022. It's a campaign that was started to start the conversation on the dangers of the drugs in our community. It is a collaboration of partners from lived experience families to public health and wellness, public safety organizations that have come together to help with prevention efforts on educating the community on the dangers of the drugs in the community.
Prevention efforts, education efforts, beautiful collaborations to just bring to light, like you said, start this conversation, a very significant one. Since your inception to now, talk to me about the phases you guys have gone through, the growth that you've seen.
Sure. So the phases that we've gone through, the campaign started in 2022 and started with phase one, as we stated, start the conversation. Don't be afraid to talk about, to your children and know the dangers of the drugs. So hitting hard on prevention efforts. Then it went into phase two, went into harm reduction efforts. People that, are in the thick of it, whether they're in recovery, whether relapse, but the importance of harm reduction strategies. So we introduced naloxone into a lot of our community events and training of the community. We also marketed the 988, 24/7 national hotline. It's a crisis and a hotline, and so we marketed it to our community as well. And then phase three, on phase one, we highlighted those that had lost a child or a family member to fentanyl poisoning. But then we also, excuse me, we introduced also highlighting those in recovery, because those in recovery are a beacon of light to help others. So it's highlighting those in recovery. And then we're now going into a phase four.
And phase four, opioids, fentanyl aren't the only things that are impacting our families greatly here in New Mexico. And so we know alcohol is another issue. It's so readily available, very prevalent in our community. And so we wanted to broaden the scope of focus in phase four. So with that in mind, we're gonna hit deep on prevention efforts, education out in the community on the impacts of polysubstance use and alcohol, including alcohol harms prevention and DWI prevention. And so we're really excited for this growth, because it's not only individuals that are impacted, it's families that are lost, it's families that are impacted in community at the end of the day.
And I think that's an important perspective to bring up, right? Like, yes, there is one individual that is maybe struggling with the addiction, but it does ripple effect out to their friends, their family, the community as a whole. So having something like Keep NM Alive, like you said, to just start that conversation. If somebody at home is watching this interview and they're like, I know somebody's struggling, I want to be involved in a way that I can help change the stigma, change the numbers, what opportunities are there for people to get involved?
So we have an amazing website. It's keepnewmexicoalive.org. There's wonderful resources that are always available in there if you know or if you yourself are struggling. But then there's also an opportunity within the website to volunteer. We cannot do the work alone. Each year we do so many community events, whether it's grassroots events or we're going out into the bigger events, and we need folks to continue that message. We are so blessed that we have over 200 volunteers right now that put well over 1,000 volunteer hours each year out in the community, because it comes from their heart. They want to make a difference, and many of these families have lost an individual within their own family, whether it's a child or a loved one due to substance use or now even violence prevention, and they want to make an impact. At the end of the day, they want to save lives, and the ripple effect of those lives saves can be immense.
Absolutely, and I think, if you are watching at home and you want to be involved, you don't have to be personally affected by drug-related addiction or anything. You can make a difference regardless, right?
Absolutely.
Really quickly, ladies, as we wind down here, what is the end goal for Keep NM Alive?
The end goal is to keep New Mexico alive, being able to be a resource and a conduit for families that are struggling. And so our end goal is to kind of take the campaign statewide.
Absolutely.
Let's
Absolutely
take it
incredible.
statewide, and like we like to say, it's not just about helping to keep folks alive, it's helping them to live their best quality of life and thrive.
Absolutely. Live your life. Don't just be alive, right?
Absolutely.
Absolutely incredible work being done. Ladies, thank you for coming in and sharing about Keep Enema Alive, an incredible campaign.
Thank you for having us.
Absolutely.